Hello, everybody, and welcome. This is Dr. Noël Crosby of AuDBliss, and I am here today with Dr. Indira Alvarez. Dr. Alvarez has been an audiologist for many years.
Yeah.
She's owned she's owned different private practices in the Tampa area and now in Palm Coast. And she actually has been involved in tinnitus in many different ways, ways that many audiologists hadn't experienced. She worked for one of the up and coming companies that had a tinnitus device called the Sound Cure for a while. And so maybe she'll share a little bit of that with us today. But I'm here with her today, and she is going to talk about her tinnitus program and how she is incorporating telehealth into that. And we're just planning on learning a lot from her. So welcome, Dr. Alvarez. Tell me a little bit about like I summed up your background, but tell me a little bit about more specifically about your background.
Sure. I am a Florida girl, so I've lived in Florida all my life. I went to the University of South Florida for my doctorate, and I always wanted to do private practice, so that's been the majority of my career. And tinnitus was just very interesting to me. I have intermittent tinnitus myself. So I have like an autoimmune condition and I take medication, and that's when my tinnitus started. And I just, as an audiologist, we learn about tinnitus in school, and I started to realize that that was really something that I could help other people with, and I could experiment on myself. So, so tinnitus was a part of my practice pretty much from the very beginning. I sought certification and training early in my career, and I got certified for the Tinnitus Practitioners Association, and I'm also the American Tinnitus Association. I collaborate with them, and I just think it is heartbreaking that so many patients have this condition, and they really think that there is nothing that can be done, and there are very effective management strategies available. So it's one of the parts of my rehabilitation practice that I enjoy more than anything, honestly. If I could do tinnitus all day, I would. I can't, but I would if I could. So hopefully that's a goal for the future, that I can reach more people. But
So, I know there's lots of different things. I always tell my patients, I can definitely help you manage your tinnitus.
Mhm.
There's lots of different strategies and techniques and programs, and we can definitely help you manage it. But of course, we can't cure it. And so a lot of times that's enough for people, just knowing that there's something that could help them. So talk to me a little bit about take me through the steps of how you see a tinnitus patient and what are some of the procedures and protocols that you use.
Sure. So patients who find me for tinnitus help, they usually find me either through my website or the local newspaper. We advertise quite a bit about tinnitus and just general information for the public. And then also through the American Tinnitus Association, I get quite a bit of uh, referrals from them because I'm registered as a member. And normally they'll call the office and they'll say, I have tinnitus and I'd like to see Dr. Alvarez for evaluation. And, the foundation of an appropriate tinnitus care plan is, really extensive and comprehensive diagnostics. So the first step is figuring out, okay, you have tinnitus. What could be the source of that tinnitus, and making sure that we're ruling out any medical issues that could be involved. So we start with a comprehensive audiological workup, which includes, audiometry, speech testing, speech and noise testing, OAEs, tympanometry, reflexes, all of that. And depending on those results, if we're seeing things like an asymmetry or something like that, then we may, I may pull in other specialists to help as far as, requesting imaging if there's something that could be odd, or just to make sure that I completely understand the etiology of that tinnitus. And as we both know, Dr. Crosby, the majority of tinnitus is, idiopathic. Like it's probably due to hearing loss if they have hearing loss, but I have patients who have no hearing loss who also have tinnitus. So although we would really love to know exactly why somebody has tinnitus, that's not always possible, but at least we're ruling out anything, that might require further follow-up, or treatment from another specialty. So that's really how we start. We also do a pretty comprehensive intake. We do the tinnitus questionnaire. We do a THI, tinnitus history questionnaire. We do a THI as well. That's my favorite kind of baseline intake for the impact of tinnitus on the patient's life. And then we do a very comprehensive history too, right? So I want to understand the patient's medical background. What medications are they taking? What other conditions may they have? Like for myself, for example, I have an autoimmune condition, and I know that my tinnitus is related to the medication that I take for that. So I think that even though we know that knowing that source or what the potential source of the tinnitus could be doesn't necessarily relate to treating or managing the tinnitus, it's important to the patient. Like they want to know, they need to know, why do I have this? Where did this come from? Like there is a definitely some emotional involvement when patients come in and they're suffering from this condition. So that is kind of our baseline intake. And once I gather all of that information, I will usually take some time to really make sure that I understand the patient's motivation for treatment or management. Many tinnitus patients, they just want to know that they're okay, right? And that this is something that is not, really dangerous, or that requires any kind of special surgery or medicine or anything like that. They don't know anything about it. There's very little information out there, accurate information about tinnitus. So for probably, I would say 80% of patients who come in with tinnitus as their complaint, that's what happens. I do an initial tinnitus counseling session. At the end of the intake, I'll sit down and I'll explain what we found, and I will offer them this session. I give them some basic information about tinnitus. I have some handouts that I give them that just give some general background information, and then they get a report of their the results from their workup, with also some basic strategies like sound rich environment and managing stress and things like that. And then if that patient is thinking, okay, great, I understand this now, I want help, I want some more involved strategies, then we bring them back for a tinnitus management session. So
Okay. So in your initial protocol or initial consult, that's kind of included in that. But then if they want further information, then they would need to make an appointment, whether it's telehealth or one-on-one. Would you?
correct. Yeah. So we're very lucky because we have Counselor. It's an excellent office management tool. They have integrated telehealth. If we don't need to do any programming of devices or anything like that, it's a great tool that we use. It's super easy for the patients because all they have to do is click in a link in an email. For patients that have hearing loss and tinnitus, where I am recommending a device, like a hearing aid that is also a tinnitus management device, or patients who don't have hearing loss, but their tinnitus is moderate to severe, and they have identified as wanting more individualized and personalized methodology for treating it, that's when a device is appropriate. Because in my initial counseling, I try to start as simple as possible. Free apps, sound machines, sound pillows, things that do not require any kind of programming or expertise, from me. I'm counseling the patient as to what's available. But for patients who are coming in right off the bat with a higher THI score, we want to start with whatever's the most effective first. So, often I will prescribe a use of some type of device that can be programmed and set appropriately for them, and customized for them. So, with that initial intake, it's very basic. It's very basic. And if at the end of the counseling where I've given them the handout and I've given them those basic strategies, they're like, okay, I'm good, then we're done. I tell them, it's important that you return every year for a hearing exam, or if you've had changes in your tinnitus or, any other symptoms, audiological symptoms that are not normal. And other than that, I'm here to help you. If anything changes, call me. Then you have the other type of patient who'll say, oh my gosh, thank you so much for sharing this with me, but, I need help. These strategies, I've already seen them online, or, I need something more customized. I need more support. And then that's when we'll go ahead and schedule the initial tinnitus management session,
Right.
where I'll put something more customized together for them, depending on whether or not that they have hearing loss, and, just giving them much more in-depth information about their condition.
Right. Well, I think that that I've been using as part of my comprehensive tinnitus treatment program. I've been using CBD in my office for about almost like going on 2.5 years now. And so I found that, that's just an alternative, some kind of help that they can get if they have a lot of stress and anxiety around their tinnitus. It's not going to get rid of it, but it's going to help take the edge off. So it really makes a difference in their attitude towards it and how they react to it, right? So do you have the thing, or do you have something that you do that's unique in your office that may if they went somewhere else, they may not get that, or something that you feel like could be really helpful if they come to you?
Yeah, actually, I was really excited when you introduced AuDBliss, because I had been looking for something like that. Because normally when I had patients with very high levels of anxiety, my go-to was to collaborate with their physician, usually their primary care physician, and make recommendations on anti-anxiety medications. And simply because, usually that patient that was sitting in front of me with this, tinnitus and this level of anxiety, um, they've had this for a while. Like whatever they've been doing is not working for them, and the tinnitus is this symptom of, poor management strategies for their stress and anxiety. And a lot of practitioners don't really see the link between anxiety and tinnitus in their patients. So, it's easy. I guess I shouldn't say that. I hear of a lot of physicians that will be like, well, there's nothing you can do about your tinnitus. And if you
Yeah.
have somebody who already has a lot of anxiety, that makes you feel even worse and probably even more anxiety, right? So my go-to would be to write a report, send it to the primary, get on the phone if I need to. I very rarely have to do that. Physicians that I've collaborated with, they're like, okay, a little bit of something that's appropriate for that patient isn't going to hurt them. But what I'm seeing more and more of, and that's what made me so interested in AuDBliss, is that patients don't want to go that pharmacological route, right? Like if they can avoid taking medications, they want to do that. And the CBD is natural. And so I think that it was a really good complement for those type of patients. Now, I have a three-pronged kind of approach to my tinnitus management program. One of them is sound therapy, either through a customized individual, programmable device, or some other type of, sound producing device, whether it's an app or something like that. But
Like
most often it's
an
an
earpod or
ear
something,
level. I'm sorry?
like through an earpod or something, or
Correct. But I will say that most often it is an ear level hearing aid that has advanced tinnitus therapy options in it. That's almost always my recommendation, because even if they don't have hearing loss, that tool is going to give me the maximum amount of flexibility.
right.
And there are lots of available options that are not as expensive as people think, that when you have somebody with normal hearing, it's, they don't need all of the fancy hearing aid stuff in there, but they do need that tinnitus therapy. So luckily, I work with a variety of manufacturers, and I can find something that will have that customization in there. And so it's almost always that. Very, very rarely is it like a tabletop device, because you can't take that with you.
Right.
And our patients they're dealing with tinnitus all day long. And oftentimes their worst times are not at night in bed. It's they're living their life, so if they're going to make this investment, I want that to be, a long-term help to them, right? So the one prong of this, I call it my trimodal approach, is sound therapy. The second one is behavior modification. I use cognitive behavioral therapy techniques just in my counseling. And we look at other behavior modification techniques as well for the patient, not necessarily cognitive in nature, but just in general, looking at their daily activities and, how can you modify your behavior to give you some improvement. And then the third one is stress management. And it's funny because you would think, do you really need someone to tell you to reduce your stress? Do I need to pay a doctor to tell me to do that? No, you don't need to pay a doctor to tell you to do that. But the reality is that many patients need to be held accountable for that self-care related to stress management. And if they don't have someone to hold them accountable, they're not really good at it. So if you're not managing your stress, then all of the other things that we're doing for your tinnitus are not going to be nearly as effective. So we focus on those three things from the beginning. Right. And the way we do that and the order in which we approach those different things is very much dependent on the patient. But that's how I approach it. And the conversation about CBD and or treating anxiety is early. It's usually the first session because, that is very apparent when you look at their tinnitus history questionnaire, for example, and you're starting to talk to the patient, you're starting to see these relationships between, when their tinnitus is at its worst and these occurrences in their life that are causing them a lot of anxiety. So again, my goal is to help provide relief as quickly as possible for that patient. And we just need to deal with those things. So it's been a welcome change to be able to talk about CBD and, give that to the patient as an option.
Yes. I love it. I love that, there's things that we've always done. And then there's looking, outside of the box and figuring out, what are some other things that might work for some people. So CBD is one. There's other things that I don't know if you've heard of any of the tapping techniques at all, or.
I have heard of that. To be honest with you, I haven't had time to look at the research.
Right.
If there is any, to be honest with you, I don't know. But gosh, what a great tool if it is
self-generated and it's just like tapping on your acupuncture points.
Sure.
And like you would say something like, even though I have this tinnitus, I totally and completely accept myself. And you just go through this process with it. And I haven't used it a lot in my tinnitus patients because I'm just kind of thinking trying to set all this up. I'm like, okay, what are all the alternative type things? And whether they work all the time for everybody or whether they work some of the time for some people and they're very low cost, what could be the problem with sharing that with people, because, and I just found an app, which I'm going to be posting about, that you can even go to this app and you can learn about it and use the app to do the tapping. So, with the CBD and the tapping and just other alternative type things that I'm learning about, that I'm going to have these resources on the website. And then somebody that's been somewhere that's been told there's nothing that you can do, you have to live with it, and they are in so much distress, they'll have just some resources of things they could try, because it's better than not having any any help at all. So,
Absolutely.
and
Absolutely.
finding somebody like you, though, would be a really big benefit to them. So even if somebody doesn't live in your area, if they live in Florida, they could still get a hold of you and possibly have a like a telehealth consult to start with, correct? So then you could figure out what you need to do, and then they could possibly come over and, see you in person. But then you could do a lot of your other follow-ups through telehealth, correct?
Sure. Yeah.
Yeah,
So, I mean, honestly, so far my tinnitus practice has been people who can drive to me. So I think the farthest I've had a patient drive is like 2.5 hours. So, I have been able to see them at least once in the office to do diagnostic testing, but everything else that we do, especially with today's ear worn devices, they all remote care compatible.
yes,
Okay. So because that is part of the management in different sessions, right? So sometimes we're changing up those therapy programs, we're changing the loudness, or we're changing the pitch, or we're changing the profile, or, and we're doing different things to help that patient find relief. But I will tell you that if I had a patient that was too far to drive, my initial recommendation after our first telehealth consult would be to collaborate with an audiologist near them so they could get the testing that they needed, a
right,
proper workup. And then, once I have that information, then we can handle the rest of their treatment. So, I think there's really an opportunity in our field for us to do a better job of collaborating with each other. Um, you know, I do not do vestibular. Okay. So I don't do any vestibular in my practice. There's a huge need and it's such an important area of our practice, but that is not my specialty. So I refer people all the time to vestibular audiologists and I educate them as to what to expect. And with the full understanding that if they need tinnitus or oral rehabilitation, hearing devices or whatever, that I'm going to get that patient back.
right.
But I think with tinnitus, for whatever reason, we don't get that as much. I don't know how many referrals you get from other audiologists, but I don't get a lot of them. So I think some of it is people just maybe don't know.
Yep,
We don't know about each other, right?
yep, and
So
this
like,
is a
I
good
know
way,
you.
right,
So I would definitely, if I knew someone on that coast, I would definitely send them to you because you're so involved in the field. But I think that we could do a better job of just telling ourselves, in our industry so that we can cross collaborate. But that's what I would do. I would send them to, an audiologist, who I know is going to do a proper evaluation, and then I could continue to work with that patient via telehealth. Absolutely. And you can actually go to my website. Palm
I was
Coast
going to
Hearing
ask you
Center.
that next. How do they get a hold of you?
Yeah, palmcoasthearingcenter.com. So it's Palm Coast
And I'll post that in
Hearing
the
Center.
comments too.
And you can make an appointment right on my website. There's a button that says, make an appointment. And, you can select me as a provider and select a tinnitus. And it can be telehealth. Usually when somebody makes an appointment, we reach out to them within 24 hours to kind of give them the details of how all that's going to go. But so absolutely. And, I actually really would love to be that first point of contact for patients, because even if it's not something I can do for them, at least I can help them find the help that they need.
Yes.
So
Yeah.
I can tell them, okay, where do you live? Let me reach out to my network, and find someone. If you feel more comfortable seeing someone in person, I can help you find someone who's truly qualified, because I will say that unfortunately with tinnitus, there's a lot of misinformation out there and a lot of ways that a patient could get lost,
Yes. Yes. So that's wonderful. And we're going to wrap it up for now, but I want to just say that, just having this, my whole goal for this is just so patients can find this. They'll know there's help different places. Even if there's not someone in their area, like you were saying, they could get the test and you could say, I need this and this, and then they could come back to you and then you could walk them through this. Because we never want somebody to be told there's nothing that can be done.
That's
There's
right.
always something that can be done. So wonderful. So thank you very much for
Thank
today.
you.
If anyone has any questions, you can post below or send us a message, or you can contact Dr. Alvarez directly. And we may be doing some more of these. We may do a Facebook Live at some point, and you can ask her questions directly. But we
That would be so
appreciate you
much fun.
watching this today, and we hope you have a great day, and we hope we've helped you in some small way. Thank you.